if somebody catches dengue, then it's very important that fluid has to be kept in mind, because if the person is having high fever, it is important to maintain the hydration status of the patient. So lots of fluids is recommended. Apart from plain water, a person is recommended to have nimbu pani, ORS, nariyal pani, bel ka sharbat, or green tea, chach, lassi, any form of liquid he or she can take, so that the fluid balance is maintained. I generally recommend to have at least 3 to 3.5 liters of fluid for a patient who's had dengue. Otherwise, in certain specific cases where some fluid restriction is there, then it becomes a specific case. In general cases, yes, the fluid has to be taken care of. In the initial phases where the temperature is really on the higher side, it is not coming down, and in certain cases we see that the platelets also go down, a soft diet is recommended, which is bland, easy to digest, easy to chew. Foods like khichdi, dahi chawal, boiled and sauteed potatoes. You can have light dal like moong ki dal, arhar ki dal, masoor ki dal. You can have all the fruits for improving the antioxidant status also. So these are certain light foods which we recommend. As the condition of the person improves, then we can gradually progress towards a normal diet, and we could include roti and other heavy lentils also. Lot of curd, paneer, charch, milk should also be included, so that the protein is not compromised, because the good protein intake is linked to a good immune system. Outside food should be a strict no-no. Very highly spiced foods or food which contain a lot of oil, which is not easy to digest, fried foods, this should be absolutely avoided from the diet of a patient. No stale foods should be given. Freshly prepared food should be given. And we recommend to add a lot of antioxidants in the form of dry fruits, in the form of fruits, different colored vegetables, salads. These things should be added. Depends on how long the fever is and the severity of fever. Sometimes the situation becomes very complex and the person has to be admitted to a hospital. Then depending on the parameters and the condition, the diets can vary from a liquid diet, gradually move to a soft diet. But if the person is at home and the fever is being managed, then for about 2 to 3 days, a soft diet with lot of liquids is recommended. And gradually after 3 to 4 days, the person can shift towards a proper normal diet, but still home cooked foods should be preferred. Outside foods during the monsoon especially is a strict no-no. Vegetarians, these general specifications have to be kept in mind. But yes, for coping up with the protein intake, a lot of lentils can be consumed in the form of dal soup, or you can make a dal idli, a dal dhokla. These are easy to digest also and give you a lot of proteins also. You can include soya in the form of Nutella, or you can have tofu as soya curd if you like it. So that's again a very easily digestible food for vegetarians. Quantity actually varies from the patient to patient, because every patient would be different in age, gender, height, weight. So if we talk about the sedentary normal adult woman, so approximately we recommend 17 to 1800 calories and about 55 grams of protein. For a normal sedentary adult male, approximately 2000 calories and about 60-65 grams of protein on a daily basis, with fluid going up to as high as 3.5, even 4 liters in some cases.